still just us.
Well, at least, but at least I know, like, I went and I redid all the links,
Yeah.
so at least that's, so hopefully somebody will join.
We'll give it a little bit and then I'll go and ask.
All right.
Thank you.
Oh, is this the presenter that
Also,
was
did
sick?
you want the lights on, or are you good with?
Oh, yeah, can you turn them on?
Yeah, it's just, I was like, it's kind of dark.
Oh,
in here.
thank you.
Yeah.
Oh, I didn't realize that.
Oh,
okay.
that's not brighter.
We're still linking to that room.
Is this the presenter that was sick today? No, okay. Maybe not.
I'll wait until and then I'll go and ask.
Sure.
Okay. But they were a bit late this morning, wasn't it?
There were they?
Yeah, in the one I was in, which was about biosimilars and
Well, we were late. We had a 9 a.m. and we were there at 9 a.m.
So in the update, where they click on the links on the agenda, those links must be the same. Because they had to update them yesterday, and they must have put the same link as well. Did you guys use the link? We did. No, well, that's fine. If you use both, let me know.
There's 2 people there.
Maybe test your sound, Betty. If you speak into that, ask them if they can hear you.
we can. Yeah, we can hear you. Can you hear? We can hear you over here.
Oh, great. Thank you. Thanks very much. We're starting in a few minutes.
Perfect. Thank you.
Thank you.
So maybe the camera's here, so
Okay.
if you
So it doesn't run with us. But here's a few camera, a few. Do you want to leave this with you?
I won't say much. I'll just come up to here by saying it.
You don't want to say anything? Okay, timing. Do you think we should fiddle with that camera?
Well, it depends on where you want to stand, I think. You're happy to stay here.
So it's there, wait.
But you probably want to point on the lectern so that they can follow there.
No.
Thank you, Irene. Could we start?
It's 7:04.
One more minute. Five, 4, 3, 2, 1. Hello, greetings. Good morning from Sydney. It's an early morning for us. It's about 7:05. Welcome to the workshop today about how to conduct research with ethical integrity. I also would like to welcome our colleagues in the Chicago Hub and invite you at any moment in time to please just put your hand up, unmute, discuss. This is a very discussion-friendly kind of session, so we're hoping you enjoy. In the beginning, we acknowledge the tradition of custodianship and law of the country on which the University of Sydney campuses stand. We pay our respects to those who have cared and continue to care for our country. Today's objectives are simple. There are 2 points: to gain insight into the foundations of research ethics and how they apply to our everyday application to ethics committees, and some more contemporary issues in research ethics that we will draw your opinion about for discussion later on. I'd like to also introduce you to my co-presenter and colleague, Irene. Dr. Irene Ong is also here with us, and she's manning the Socrates.
Yes.
And the voting, so hope you enjoy and are able to join us in discussion shortly. So what we're going to do is, first of all, an introduction and some history of research ethics. Then we're going to do some case studies and discussion about pertinent issues in research ethics, such as authorship and IP and whatnot. We will take a break, and then we'll have more cases and discussion, and they will touch on plagiarism, intellectual property, and conflicts of interest. So I'd like to start with a special acknowledgement. This workshop has been inspired and collated with materials from the Research Integrity Office of the University of Sydney. Special thanks go to Matthew Wynne and his team for their contribution to aspects of this workshop. So I'm going to start by going back a bit in time, and I hope you'll bear with me a little bit, but I doubt there is a person who is attending or listening to this workshop later on who hasn't submitted an ethics application to a human research ethics committee for approval. And when we talk about that, most of us will roll our eyes or groan and moan and think, oh, what a task. But every single question in those long questionnaires have meaning and have foundations, have precedent to them that actually make sense when you know the story. So I'm going to tell a story. So there is a moral imperative to research, but also a moral imperative to research morally. And that's what we're basing our whole workshop on today. Why is it important that we talk about research integrity? Whilst we all know that everyone has their morals and has their integrity, but in fact, in the world of academia and research, high quality research that is trustworthy and reproducible requires that it be conducted in a responsible manner. So cutting corners, disregarding responsibilities and failing to satisfy obligations can result in research code breaches, which can have serious consequences to reputation, loss of public trust, research funding impacts and other sanctions, implications for theses and degrees. Most damaging, I reckon, and I think everyone would agree, all of us would say, reputational damage. Once a research project has hit the media, whether social media or just the ordinary newspapers and news bulletins, when someone has reported something incorrectly or something has been withdrawn from the Lancet, all hell lets loose. So we really want to avoid that. So as I said, I'm going through a brief history and how, you know, ethical research principles emerged. We'll talk about some human research ethics, how these reflect on what is required of us from human research ethics committees, and then human research beyond the research, I called it, but we'll talk about that in a minute. So as I said before, what do you think when you hear the term, you know, research ethics? So I'm going to do ethics today, or I'm going to submit. As we said, you know, everyone rolls their eyes and moans and groans, but what do others think? What do you think when you're a participant in research, and how does that differ to how you feel as a researcher? You're keen to go out and explore and gather the data, but the participants see it in a different way. And they will tell you there is trust, but we still want some control. We do trust you, but you know, there's a but there. And why is that? So going back in history, of course, before the 1800s, a lot of exploration into the human condition was done on cadavers, on dead bodies. When experimentation began to be a little bit more on live bodies, it was typically started with, vaccinations. And Edward Jenner's first smallpox vaccination was captured in this picture, which is quite illustrative of what we're talking about. No consent, nothing, a little bit of tug of war, bit of resistance. No one knew what, I mean, the concept of informed consent had not been formed, but this is the beginning, right? So there are people who were not too happy with what they were seeing.
Also a child. Like,
yeah, and the child, being a child, even worse, yes. And that was like, if you look at it, you feel so sorry for that child tugging away. Being a little bit further on, Pasteur, the well-known Pasteur, everyone knows about, he was known for first finding the rabies vaccine. But whilst he was working on it, some people died of rabies or smallpox, because he worked on that as well. And no one was thinking about consent yet. When Hansen tried to vaccinate one of his servants without her consent, nothing bad happened to her. However, she took out a court case against him. And this initiated, for the first time, self-imposed, self-testing. So he said, okay, all right, I can't test on others. I'm going to test on myself. And that was quite a milestone in terms of consent and understanding, you know, how people feel as they're being guinea pigs to a research project. And as you can see, this is on the cusp of the 1900s and just before World War I. Okay, so we're getting to understand that people are not obliged without consent. It wasn't that popular. It was kind of very tense, if you like, in terms of testing human beings, live human beings, and what might happen to them. So before World War II, people think that World War II was the big milestone where things changed a lot, but actually there was a lot happening before that. And in Germany, there were experiments being conducted that were kind of raising eyebrows, so to speak, but hadn't quite taken shape too strongly. But in the USA, there was more push than concern. They wanted to go out and test people. And the yellow fever research project is a famous one, which was right on the 1900s. And in that research project, they wanted to test soldiers. It was rampant and amongst the army, and people were dying, that soldiers were dying of yellow fever, not of, you know, warfare. So they conjured up this research project where they gave any soldier who would sit or who would sleep in a tent that was mosquito infected and most likely get yellow fever, they would get a bag of 100 gold coins. If they got the fever, they'll get another bag of gold coins. Just imagine in this day and age, if you get 100 gold coins, I mean, it's outrageous. And if they died, another pack of 100 gold coins would go to their family. And quite as they suspected, people, the soldiers recruited, the soldiers gave themselves to this project. And this was the first occurrence of informed consent. They knew what they were walking into. They took their risks. But this was also a first example of coercion. So when you see in your ethics application, you know, how did you recruit? Don't complain, don't groan because they want to know exactly how you're approaching people, because of these precedents and these stories that have shaped the notion of coercion. So we're still in the early 1900s. Of course, World War II, research just got worse. On prisoners of war, we all know the stories during and post World War II. But what we know, common knowledge about the prisoners of war in Germany wasn't limited to Germany. The issues that arose in research ethics were not limited to the Germans. Many, many medications, chemicals, poisons were tested on trapped prisoners in different countries, and they died in their hundreds. And of course, after the war, the Nuremberg trials were conducted, and we got, after the Nuremberg trials, the Code of Ethics for Human Research, which I'll be going through in a minute. But I wanted to also flag to you that it wasn't just the Germans. So if anyone has heard of Unit 731, and you have a firm gut, have a look at it, because it is gut churning. It is gut churning. This story is horrible. This is when the Japanese went into China and they set up 132 covert experimentation camps, and they undertook biological and chemical warfare research and development on live humans. It was all lethal. It was very brutal. Live patients were, never given anesthesia, limbs cut off, reattached on the other side, guts opened, people suffering and in agony, dying in very dire circumstances. They estimate up to 500,000 died in absolute sheer terror and agony in those camps. And what was the research question, you think? The research question was like, what does an arm do when you attach it on the other side of the body? Or what exactly happens when you feed someone really, really well one night and then you drain their blood the next day? See how long it takes before they die. Or something like that. Hence, I take you back to HREC applications. Why do they ask us about scientific merit? Why do they ask us about the aim and the method? It's because we are trying to establish as a committee or as committees, they're trying to establish that there is scientific merit, there is meaning to the research question, that there is no harm and there is no expectation of dying. The irony of Unit 731 was that the researchers, well, we'll use inverted commas, the researchers at that Unit 731, when they became prisoners of war, they were not prosecuted. You might ask why? Because their data was used as an exchange for them to be freed of prosecution. And that was an ironic kind of finding, or reading that, you think, what was the point of having them, but they got the data, they got the human research data, and there must have been benefit in that. But up until then, ethics in research was still a function of politics. So in Germany, in China, in Japan, wherever it was, the most enduring code of research ethics is the Nuremberg Code. This was in 1946, straight after World War II. And you'll see 10 requirements. And these are that consent has to be voluntary. It has to be consent and it has to be voluntary. That experimentation will yield fruitful results. It's not, on a whim or just because. We just want to know. There has to be a reason and a meaning. That previous research justifies its conduct. In other words, that's why we do a literature review. That's why we establish the background. We're not duplicating and we're not causing people to go through another research project just because. Nothing, no unnecessary physical or mental suffering is to be expected. No reason to expect death. Risk never exceeds humanitarian importance. And prior arrangements to protect subjects has to be there. That's why you're asked, if something happens, what's your plan B? Or what is in place to help your participants if something happens? It's conducted only by scientifically qualified people, because that's why we're asked to supervise, and that's why we're asked to take responsibility and accountability for everything in research, and that the subject can withdraw at any time. These are these principles are the golden standards. These are the foundations of research ethics. Whatever comes after this is additional. It's based on a few contemporary complexities of research these days, but the basis is right here. And the researcher can terminate the study if too high a risk. In 1964, the World Medical Association added a little bit, but I'll mention it, but I've not seen it that foundational, but they added that the well-being of the subject takes precedence over science and society, and that the duty of the researcher is to protect life, not to risk any harm. Subjects must be volunteers and informed. So I guess the word informed has been inserted, and assessing risk versus benefits and giving greater weight to lessen the risks. So that was the Declaration of Helsinki. Some people will refer to the Nuremberg Code and others will talk to the Declaration of Helsinki. Basically the same, very similar, just a little bit more in the Declaration of Helsinki. After World War II, there have been forces of change. Our social fabric has changed. Our outlook, our conduct of research has changed as well. And so has technology. So what were the first forces of change? Of course, World Wars I and II, Nuremberg and Helsinki. Then in the 60s, we got consumerism, the rights of a consumer, autonomy and justice began to be introduced. We haven't had bioethics articulated yet, but this is the movement of social justice, moving slowly into our communities and our social fabric. Feminism was a very strong force of change, still is actually, very much empowered by the contraceptive pill, which was introduced in 1960, and it gave balance to a power imbalance. So in a way, the contraceptive pill weighed in quite heavily to the cause of feminism, and it also had an impact and still has on our social being. Anyone who is interested in the world today will be very interested in Roe versus Wade, for example. Women's rights. It moves a country. It moves politics. It has a profound effect on people's lives. So we could call it feminism. We could call it healthcare, but it is about the rights of the human being, of the human condition. At the same time, there's been a lot of highly specialized innovations and medicines. I'll mention cloning, for example. I'll mention, vaccinations. I'll talk about, nanoparticles, things that we had never known about and are coming through the pipeline with a lot of force. And these have changed the way we do research. And with that, and with the medicines that have come through the pipeline, we also have elevated expectations. We can now cure some cancers, things we never dreamed of in the 60s and 70s. People were, giving up. Today we don't, and people's expectations are quite elevated. Around this time, there has been an emergence of something called bioethics, a set of principles about healthcare ethics, which are driven by two very, very old principles and two quite new ones. And the new one of the new ones is the principle of autonomy, and that means the respect for the individual, respect for personal individuality, their privacy, their consent. The consent is meant to be informed, uncoerced, and they have to have the capacity to understand. And they have the right to refuse. All of these principles come under one big umbrella of patient autonomy. And then there's justice, which is equity for all persons and species. That means equity to access, equity to in services. If you apply it to pharmacy, equity in distribution and access is very important. And give you an example of what we've gone through in COVID and the times when some people were restricted to certain vaccines and others were not, with not much justification. So justice has become a very important principle. Of course, the ancient principle of beneficence, meaning to do good, and non-maleficence, to do no harm. And these are all 4 major principles of bioethics, which have also impacted heavily on research ethics. So here I'll pause a little bit, and I'd like you to think, what else, like we've talked about in consent, we've talked about, you know, forcing people to undergo research and how far we've come along. But in this day and age, let me ask you, what else could go wrong? What has changed? What has evolved? I'd like the Chicago hub, if you're still with us, if you'd like to join us. Would you like to unmute?
Yes, we can still hear you.
Yeah, would you like to chat about what else could go wrong other than what we've talked about? No?
I think we're okay for now. Thank you, though.
Okay.
The handheld works better than the eye you're using here. I don't think that one's working. I might have to use the
This one?
One thing I've seen, I can give an example that I saw when I was in Scotland is we go through all these checks and balances, but the public aren't aware of them. And sometimes I'll see the results of a project that had ethics approval and not understand, and there can be quite a large uproar over that project and the results that have come from it, because people will share things on the internet. I think they're more informed about research and science than they are. And I'll give the perfect example, I think. When I was in Scotland, University of Dundee had ethics approval. They wanted to look at the development of the eye. And they went through this very long ethics process to get permission to sew the eyes shut of kittens when they were born. And I can't remember the justification for it, but they had a full proper justification why they had to do it that way, and they couldn't do it another way. And they went through the ethics, got all approved. And then it came out, the state came out somewhere, and it was the biggest thing you've ever seen in the papers after that. And the people got really, really offended by that this project would go ahead. Yet there was complete justification for it. And I mean,
Do you think they were fully informed?
No.
No.
no, because they didn't know the checks and balances had gone through. And you know, when people read a research paper, it'll have a line that says, you know, this has ethics approval from blah 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 blah. And
Yeah.
that's the extent I think the public actually knows about it.
So what's happened there is that the ethics committee has approved the protocol and relied on the researchers to undertake the research and do it properly, do it ethically, but they failed to inform. And informed consent is when, I think in court, is when a reasonable person is estimated to understand what's going on. That's how, you know, the measure, it's not easy to measure either when, if it goes to court. But informed consent has its legal standing, has a precedent. There's a lot of examples on it. When I think here we have a case that was a precedent here in Australia about a woman who was blind in one eye, on the subject of eyes, and her doctor, Dr. Rogers Whittaker. To Rogers, and she was Whittaker. It was Rogers versus Whittaker. And she sued him because she became blind in her second eye, even though he promised her nothing would happen to it. Nothing would happen to that eye. No way would you lose your sight. But what happened was she got infected in one eye, and then she got sympathetic infection in the other eye and went blind. So she sued and she won the case. And that was our precedent here in Australia for informed consent and the obligation to inform the patient participant in whatever they're going to do. But I want to push a little bit further and talk about other things that what we've talked about are bigger picture, and they're very, very foundational. But in today's world of research, we also have issues emerging about intellectual property, collaborative research, domestic and international, how we conduct it, how we do our ethics, how we, because some countries feel that other countries are underdeveloped and don't need to have consent and don't need to have interpreters, and there's no need, we just go in and do the research and come out. A very big issue is authorship dispute that's emerging as a very contemporary issue regarding research ethics. Conflicts of interest, understanding what a conflict of interest is and not being afraid to call it what it is, because not all conflicts of interest are bad, inverted commas. Making sure that a researcher identifies and discloses. Implicit and explicit bias in peer review. You notice sometimes you send in a manuscript, it comes back torn asunder, it's kind of torn apart, and you wonder who was reviewing this. Plagiarism. Today, with the advent of software, Turnitin, as an example, a lot of students' work in theses, whether it's honours or PhDs, are put through the software, and there's quite a large amount of plagiarism being, or inverted commas plagiarism being uncovered. That is for lack of understanding of some of the requirements of contemporary research these days. So also, data management. Why are we now requiring researchers to use certain databases or platforms that we weren't required to use before? I can talk simply to that, probably because one young researcher forgot her USB on the bus. And something like that can cause so much mayhem in terms of privacy, in terms of, you know, loss of identity cover. So many things happened with one USB that everyone set up a new data management plan for all research happening at a university. I'm not sure if that happens in the US. Can I ask the US, the Chicago Hub colleagues if they have data management requirements in research these days?
Hello, hey. Yeah, that is a really good point. I will say, I'm sorry, I should introduce myself. My name is Sujit Ramachandran. I'm at the University of Mississippi. We do a good bit of work with what we call big data these days, which is data from health insurance agencies that share their health insurance claims data with us. This is data on hundreds of thousands or millions of individuals, and often data security and privacy become huge concerns because it is not logistically feasible to obtain informed consent when you have a data set with millions of individuals. So our ethics committees often approve waiver of informed consent, asking researchers to follow certain regulations and rules when they use that data. And obviously, we try to do our best with doing things correctly, but I can see there is a lot of potential for violations of privacy or security when using such avenues.
So, so is it a requirement of the research project, whatever research project, to have very secure data management platforms and use them?
I think that depends on the data source and from funder to funder. The data that we work with, we obtain from the government directly, and they require that we operate a data security center that has what we call HIPAA protections and laws in place. So we have to follow several rules in terms of who can access it, how that is accessed, how it is documented, so on and so forth.
Right. So it's relatively new.
I think it's been around for the past 10, 15 years now, but yeah, on the scale of things that you are discussing, absolutely, yeah.
Mm. Thank you for that. Any further comments, or would anyone like to comment on anything so far?
No, I did want to say that some of this data management that I think the ethical issues we are most concerned with is that sometimes when governmental sources share these big data with us, they do not have the capability to anonymize the data before they send it to us, and they rely on the researchers to follow privacy and regulations when they work on the data, which is okay. But when we work with graduate students and staff and so on and so forth that now has access to individual social security numbers, names, addresses, healthcare information, there is a lot of potential for disclosing individual privacy or committing things that would not be considered remotely ethical. And I think we've managed that okay, but I do wish there were a better framework, better structure in place to account for that, if you will. And it's always hard to do that when you're dealing with hundreds of thousands of individuals in a single data set, right? So I do wish there were better safeguards in place for that.
And can you ask those who provide you that database to remove that column, for example?
We could, but the people we work with don't have the ability to do that. So that's the technological barrier that they face. So they rely on us to remove whatever we can before we work on the projects.
There is a risk there, yes.
Yeah, the government agency does not have the technical ability to remove those columns of data. Unfortunately.
So you will have to be very ethical.
Yeah, absolutely. So as a faculty member, I have access to that data, and then we put in several safeguards and steps in place to remove those columns and regulate who can access the data, how long they can access it, what they can do it. But I do it as a faculty member. I wish the government data source would do it instead of me. I don't want to have that on my shoulders, if you know what I mean.
All the more reason we have to be more aware of things. Thank you so much for your contribution. So anyone like to comment on any of these topics, because we're going into our scenarios now. Yes, no.
I'm interested in the do no harm aspect of it, because it's a very deontological moral philosophy look at it. It's the action that's important there, not the consequence. Could you see any scope, and I can't think of a scenario where this would actually work, but let's say COVID, everyone's dying from COVID, millions are going to die, and say, look, I'm going to run a clinical trial, but there's a good chance that 10 people in the clinical trial could die. But in the end, it's just, we've got more Machiavellian rather than deontological for moral philosophy. We say, all right, well, I'm going to save 2 million lives.
Yeah.
Do you see anything like that being improved, or is it really the same to say of the participant trumps everything else?
I would say it trumps everything else. It's hard to unless, you know, everyone is informed of the risk, fully informed, a bit like the yellow fever story, without the coercion, unless you've got 100 coins to give them. But COVID, taking the risk of having COVID would mean they would be fully informed. I think the ethics committee would struggle with it to approve it, but under certain conditions and a lot of informed consent about it, that every person knows what they're taking. I don't think it'd be approved for children, for example. It'd be very difficult to get, like even parents to give informed consent for their child is difficult. That's why, you know, a lot of research on pregnant women and children is stalled because of this issue. But with so much going on with COVID, people might like to take research, a risk. Maybe they might. You're entitled to give it a go, but I don't think the ethics committee is going to give you an easy time.
I have no plan for clinical trial.
No, but it does happen, and you know, people have to know about the risk before they go into this research project, for example. And once you've got them signed, that's why you sign them off on a consent form, and the consent is fully fully detailed about exactly what risk is involved, you've got their signature. You're not supposed to take the risk, not expect anyone to die, in principle. Andrew wants to comment. Andrew has a lot. Andrew, let me introduce, Andrew also is Dean of school and
I'm
is
lucky enough to be involved in ethics.
in
So I think
ethics
your
for many
comment-
years.
Your comment there, Noel, is an important one because every decision is weighing up the beneficence with the non-beneficence. And particularly for, a good example would be cancer treatment. So let's say a lot of new cancer treatments will be tried, investigated in people who have had, at the end of their options. So they've been, fourth line treatment has not worked. So there's a new medicine, often with uncertain harmful effects. We know about mechanisms. So you have some suggestion that, we know from animal models it's likely to work. So there's some uncertainty there. There's beneficence, the possibility that it might arrest or delay the progression of the cancer, although often unlikely. And really it's about balancing what do we know about the harms. And there's plenty of participant information sheets that would articulate that there is a possibility that this new treatment could lead to death, and that has to be articulated. And really you're dealing with uncertainty. So I think you're a little bit too black and white if you said we know 10 people will die. We often don't know, and what a committee is doing is weighing up the possible benefit of completing that research, not only for those participants, but also for the people. And often in, say, cancer trials, maybe those individuals, and it's often articulated, this treatment may not benefit you directly, but it will help us understand. And healthy volunteer research is like that, of course. It won't directly benefit you, but it will help others. And there's often appropriate remuneration for being involved in those studies, which I think is interesting.
Well, I was going to actually ask about that.
Just before we get to that, one of the very important things about the consideration and approval process and consent is that, and maybe it's one of the things I think quite important, maybe tied up with some of these points here, is ongoing monitoring. Once a trial has been approved, people have been consented, that actually the research is conducted as outlined in the protocol. And one of the gaps I see is that often that's not heavily or not adequately supervised to confirm that. There is a massive element of trust. Obviously, there's a huge reputational risk for people who might deviate from a protocol. And of course, for major trials, there is a monitoring process internally, which makes sure that they follow the protocol. But for a lot of investigator-initiated studies, we don't always have the confidence they're conducted exactly as they're done. And sometimes an ethics committee will put in place monitoring, around that to make sure that research is conducted according to.
And they snap into action if there's a complaint.
Yeah, of course. And a complaint is a trigger that should be investigated. It should be not, the complaint itself needs to be investigated for the facts rather than, a conclusion. But if you wanted to ask another question, I'll give you mine.
Thank you.
So I've also been Googling either the right or the wrong things, but Facebook has started giving me ads for volunteering to be in clinical trials. And I noticed one of the things they always mention in the ad is that I'll be compensated for my time. I imagine with ethics, it's a very grey area where it goes from compensation to coercion.
Yes.
Is there any research around that?
I don't think there's a research, but there are principles. Yes, Andrew?
Yeah, no.
It has been.
Thanks, Noel. So, as a young man, I participated in quite a lot of studies, and it was not really a way to make money. I actually learned a lot about research by being a participant, actually, particularly in clinical pharmacology studies. But an ethics committee will always consider. So, for example, patients with a health condition usually are not compensated financially, but things like their meals, their travel, their accommodation, any visits, any treatment costs are covered. So there is a financial incentive, if you like, because they're, and let's face it, access to new treatments in some areas of healthcare is actually standard care. If you're at the end of your line for complicated hematological cancers, then being in a clinical trial is the best thing you can do. You'll get the best care and the best options. For healthy volunteers though, there is a fairly, I'm involved with the National Human Research Ethics Committee called Belgrade, and they have a protocol around, that if it's a full day of engagement with, requiring you to stay overnight, this is the ballpark of compensation for your time. So if people have to take time off work or be available around the clock, then you can imagine that appropriate compensation is important. It is a payment, but it's not. It does have to walk the fine line of being an incentive or not. And of course, the motivation for a university student might be, hey, I can sit around and take this medicine, work on my computer and be remunerated for it. There is a genuine interest. There's a lot of research on why people volunteer. That's a very interesting aspect. Obviously, financial compensation is part of it. And I also know there have been trials where they failed to recruit because they have not offered enough. They've come back to the ethics committee and said, we'd like to increase it to this amount. And that's been a reasonable approach because they've figured out that $500 for 4 days of activity wasn't enough. The other interesting thing is that you might receive a payment for being screened, but you'll receive the complete payment when you complete the trial. So that's, that's helping the participant. And again, this is about being fully informed. So if they understand that is the requirement and they understand they can ask questions about it and say, okay, well, I'm agreeing, I'm undertaking to do that. And the other, people in this room are researchers. If you've ever had a participant not finish your study, it's a very, very frustrating thing because you may have invested a lot of time. So it is and I'm here particularly talking about healthy participants. That's a very frustrating thing, of course. So being very clear about the expectations in the participant information sheet and asking someone to sign up to that is important. If they choose to leave, then you can say, look, that's great. At any time you can leave, but you haven't completed the requirement of the study. So that's a very interesting aspect of remuneration for health volunteers.
Did that answer your question, Noah? What do you feel about Facebook recruitment?
How do I feel about Facebook recruitment? I've been involved. I'm being involved with 2 clinical trials at the moment. I have contacts who run clinical trials companies, and the number one thing they say is we can never get people to come to the clinical trials. So I understand why they do it. I'm thankful that I'm not in the business of ethics for clinical trials because I don't know where my position would be. But I understand both sides.
Sorry.
Is the Chicago hub able to hear everything?
Yeah, we can hear it all perfectly. Thank you.
Thank you.
Just quickly on social media and clinical trials. Every advertisement for a clinical trial must be approved by the ethics committee. So it's not just about someone going, hey, we've got a clinical trial on. If you participate, you can get paid for it. The wording, the images, and everything, strictly speaking, must be approved by the ethics committee. And actually, if people are going outside of that, then they're in tricky territory because they may be coercing people by the manner in which they even communicate that. So the platforms are very important, and usually a social media advertisement might also have a protocol number of who's approved it as well, so that if you're reading it, that's right, this has been approved by. And the wording should be that are you interested in there's a sort of standard format. Increasingly, I know the applications we see on our committee, that they use quite a lot of images to generate interest. So that's an interesting part of just how they connect people. But social media probably is no different to what used to happen, and that would be a poster in the corridor of on a university campus around the walls, and we still do a little bit of that, interested in participating in something. So, I think even those ads, any posters,
they all have to be approved.
The other interesting thing would be if it's a radio ad, the exact script of what will be said. you know, gets approved as well. We see updates to that if they want to, the situation's change. So again, it can all be done appropriately with the right controls.
Okay. We tried to be a bit more inclusive. Sorry. Okay, we're going to start case 1. I think. Oh no, I've got, yeah. So to illustrate this, this evolution of research ethics and the complications of modern day research, one of the first and most famous cases in research ethics history is the one involving Dr. Nancy Olivieri, who is still alive and still working, and a prominent researcher and clinician specializing in thalassemia. She was involved in a research project with Apotex for 6 years, collecting data, and deferoprone was almost going to be approved for use for thalassemia instead of you know, the iron chelation treatment every night, subcut, especially for children, which was and still is a ridiculously kind of messy treatment, but it was working. This one, she observed to cause liver fibrosis on biopsy. And she came home one day to find a message on her phone, and she was told in no uncertain terms, you must not publish or divulge information to others about the work you have done with Apotex without the written consent of Apotex. Now, should you choose to violate this agreement, you will be subject to legal action, and she certainly was. She was subjected to the utmost pressure at the hands of Big Pharma, and for a while, she was fired. She lost her job because Apotex at the same time donated a whole wing to the university that she works in Toronto. But the world of bioethicists was getting stronger at the time and started to speak up for her and advocate for her. She did endure years of frustration and humiliation, and not only from the company, from Big Pharma, but also her participants were really disappointed because they were relieved of the every night subcut, you know, treatment. So this was capsules and it was easy and they were happy with it. And why are you bringing this up now? But she knew what was in their best interest. And after years of humiliation, she won her job back. She was reinstated at the university. And eventually in 2009, so it took a while, she was awarded the American Association for the Advancement of Science Award for scientific freedom and responsibility for her resolute determination that patient safety and research integrity come before institutional and commercial interests, and for her courage in defending these principles in the face of severe consequences. She endured a lot. But Olivieri, the story stays on, and this explains why. You get the question, are there any restrictions on your publications? Are there any restrictions on the conduct of your research? Not from the Human Research Ethics Committee, but from your partners, from your collaborators. Are there any pressures on you? And this is precisely why. So Nancy's story is very famous, and it's a long story. There are, you know, videos and YouTubes and all sorts of things that are interesting to know about her. But as it relates to what we're talking about, it's important to know that the impact of or conflicts of interest, intellectual property need to be sorted out before you sign up to be a researcher with big companies, big pharma. So do we have any questions or any stories up until here? Because the next slide will be a study, a case study. Anyone in Chicago, would anyone like to speak?
We don't have any questions over here.
No questions. Okay. All right. So we're going to, no questions here either. Irene?
Okay, so for the next section, we're just going to, for the rest of the workshop, we'll be going through some various case studies and just to see what our audience and delegates think. It would be great if you participate. So here you can either go directly to this URL. Otherwise, you can search for Socrative in a search engine and you can enter the room name July 13. Otherwise, you can use this QR code and just scan it. It looks like all of our Sydney delegates have joined. Chicago, do you mind just giving a thumbs up or just an indication that you've joined as well?
Yeah, there's only 2 of us, so I think we're both in now.
Okay, great, thank you.
Yeah. So our first scenario is Natalie. Natalie is undertaking a PhD and finalizing a literature review to submit for publication. She's worked on this literature review independently with some assistance from her 2 PhD supervisors, Professor M and Professor T. However, her main supervisor, for some reason, instructs her to include another doctor, a senior researcher, as a 4th author on the manuscript. Now, Natalie doesn't mind. She actually likes Dr. C. Besides, Dr. C is an informal mentor to Natalie and works in the same research field. So our question is, should Natalie do as she's told and add Dr. C as an author?
You want what the right answer is, or what we'd actually do?
You can do both.
Click on your little box out there, your.
Can we take it? Yeah.
There you go. Okay, let's answer the question.
This is a growing issue. Yes.
Did the doctor who Dr. Natalie and the doctor add his contribution to this?
No, the scenario is as is. So he's a mentor.
There is no contribution.
So you can just answer it just based on this scenario and then we'll discuss it together. We can go
We'll
into
discuss
it, break it down a little bit, but just on the surface, whatever you think. Yeah, there's no right or wrong. We can discuss it.
Are you able to?
Just make sure I'm sharing the screen. Results. Okay, so this is the results of our delegates and colleagues. So 100% of us have answered no to this scenario. So should Natalie do as she is told and add Dr. C? We've all disagreed.
Okay. Would anyone like to talk to it Why would you disagree? And Niall, you said, is it what I do or what I should do? Here we are. How did you get this out of? Just pull it out.
Natalie's in an incredibly vulnerable position here. And I think if she does put Dr. C on the paper, that's not the ethical thing that's gone wrong. The ethical thing is Dr. C being the senior researcher, asking or even consenting to have their name put on the paper. That's the issue. And that's the person who's in a position of power.
What about the supervisor?
And the supervisor as well, right? And the only innocent person here is Natalie. Right?
Yes.
But Natalie's the one that bears the brunt of the decision and the consequences of it. And I think in the real world, Natalie would just put the name on the paper without even thinking about it. Because she's got 3 senior people that are all more experienced and know the nuances, because we all know there's what you're told to do and what actually happens in the real world across all industries. And I mean, if you go to Germany, right, the head of the lab in Germany for sciences always gets the name on every paper that comes out. That's just the norm.
It's a culture.
It's a culture, right? And as far as Natalie knows, this is the culture of where they are. She could be a first semester PhD student, or she could be a final year PhD student. But anyway, that doesn't really change it. But the ethical problem here is the supervisor, not Natalie. And I think Natalie in the real world would 100% just put the name on the paper.
Right.
She
And this is
shouldn't,
why we're
but she will.
discussing it. Do you think it's the right thing though? Like, is it the right thing for the supervisor to do that?
No.
The power imbalance is what, you know, really is quite outstanding here. Did you want to give it to someone?
Unless the senior, the Dr. C might have committed for that paper. For example, publication or like well known in the area, and he might be even like some general advice or comments that might be a contribution.
Would you put the doctor on the manuscript?
For myself, I'll ask my supervisor why.
Why?
Yeah.
You would ask why?
Yeah, why should I put the question on my paper? And if I get a reasonable answer, then I might put it. Yeah.
Okay, you might consider it.
Yeah.
Okay. And
Thank you so much. I think this issue has 2 aspects. The first aspect is an ethical issue, and the second aspect is a legal issue. The ethical issue, how could the supervisor ask his PhD to put us in the paper without a contribution? And legal issue, I think I agree with Dr. About the power of the supervisor, yes, to enforce, it may be enforced, or the PhD student to add the Dr. C to the paper actually. So I think it will the PhD student need to go to the head of the department to discuss this issue and to prevent this issue in the future.
okay,
Thank you.
I will comment on this. Andrew, what are your thoughts?
I think obviously Natalie is learning in her research career, and it's disappointing that she might be put in this situation. And of course, internationally, in Australia nationally, and for most journals, there's very strict descriptors around who qualifies for authorship. And they also often make explicit statements about who does not qualify
Yes.
for authorship. So someone who simply read the manuscript, someone who might be a head of department who's not contributed. And, you know, there's now an increasing focus, of course, for Natalie have to write on that manuscript, what was the contribution of each person? And I think Natalie's then in a position to say to the supervisors, and what should I write is Dr. C's contribution? Was it concept of design? Was it acquisition of data? Was it about analysis, interpretation? Was it about reviewing and approving the manuscript, which are each of the elements, at least two of those need to be met typically for someone to be identified as an author.
Yes. Deb, do you want to talk to this? If I said to you, Deb, I'm the supervisor of one of the attendees. If I said to you, I need you to put Irene on the paper.
I mean, yeah, you know me. I mean, if you told me, I mean, like, I'd trust you. I'd be like, well, I mean, and you've taught me ethics for the last 4 years. Surely if Betty told me to put Irene on, like, I'm sure she's not breaking any ethical rules, but I mean, it's all about like the situation that you're in and like the circumstances around that. And so, I don't know, like as a junior researcher, when your supervisor tells you to do something, sure, you might like ask them, oh, like, why should I add Irene? You're like, oh, because she's a good gal and she needs to be on the paper, and I said that. And so you're like, okay, like you don't want to be in the bad books of your supervisor. Realistically,
So
like,
the
you want
words,
to be in a good place.
the words that come to my mind are vulnerability, power imbalance, inappropriate supervision. And I think the culture needs to change, because it used to be, as Niall is saying, it used to be acceptable. It still is quite rampant, so to speak. I would say that it's very common, but I think we need to get to the bottom of it, because no one really agreed to it. No one agreed. In their heart of hearts, everyone knows it's wrong.
Yeah, I think even Dr. C might say no. If he knows he's gonna be put on that paper, he might disagree. So
True, Hattie, he might say no, but you know, people are not going to turn down authorship that easily. And there's a reason for him to have been invited. And those reasons need to be changed. I'm advocating for change. I know things happen. I'm wondering if I could invite someone from the Chicago Hub to comment on the scenario, what your thoughts are.
Hey, this is Sujit Ramachandran from the University of Mississippi. I thought this was a great scenario. It was obvious to me that the answer should be no, but I agreed with some of the discussion there that I think it does happen fairly often. And I must admit to seeing that among people that I work with, where people have been added as co-authors on papers that I do not think were fully deserving of authorship as per the ICMJE guidelines. Yeah, so I think it's a very good scenario, but I will admit that I think it happens way too often.
Well, I think we're going to have a few scenarios on this topic in different forms and shades. I'll probably talk to it more, but I think the position for the future should be more awareness of the rights of the student, also to say, no, I'm not quite convinced. Although that takes a lot of moral courage, but I think we have to make it easier for them to ask why. I think as supervisors, as experienced people, we need to be responsible. No.
People act based on the consequences that are going to happen. And
True.
M, T, and C here are acting because they know there's a benefit to C. And if someone came to me and said, we've put someone on the paper who didn't deserve to be there, we've been found out, what's going to happen? I'd be hard pressed to say that there's going to be any punishment at all. Like, I don't even know what the response from the university would be if you asked me to put Irene on a paper and I put it on the paper and then it came out that Irene didn't contribute. I'm not sure there's a
Sorry, we're using users.
Maybe we need to start looking at having consequences for people not acting when that's clearly black and white.
So maybe I will divulge some of the cases that have come to my attention where a complaint has been made, for example, for authorship. Be it someone who demands, or be it someone who rejects, or both. And it's really difficult to decide. But what happens is the journal actually comes back, the complaint goes to the journal, and the journal comes back to the University Integrity Committee, and it gets discussed there. And then it goes on forever. Would that be right in Chicago? Is that how, or Minnesota, or is that how you in the US would do things?
Yeah, I think so, but I agreed with the earlier comment as well, in the sense that the consequences are important, and I don't think there are any such consequences at this point.
You don't think there are consequences?
Well, in the sense that when journals require individual authors to make authorship roles more transparent, I think there is a better check in place for making sure there are no authors who have not done the requisite tasks to earn authorship on a paper. But I do not know that at an institution level, there are enough checks and balances in place to place those consequences on students like Natalie in this scenario, for example.
And in your honest opinion, do you think there should be checks and balances implemented and penalized if not followed?
See, I do think there should be, but I think this goes back to a carrot versus a stick question. Should there be a positive consequence for doing the right thing, or should there be a negative consequence for not doing the right thing, is the question in my mind. Because I do not believe that a young graduate student, like in this scenario, must be penalized for adding this Dr. C as an author, when it seems to be in her best interest to have her mentor be a co-author with her on her paper, in order to further her mentorship, or to, be in the good books, if you will, of Dr. C. So if anything, perhaps we need to incentivize Natalie to do the right thing with a carrot, not with a stick. But I don't know what that structure of incentives would look like.
Niall, do you want to comment? Okay. Okay, I'm going to call for a 15-minute break. We'll come back. We have a few more scenarios like this. We're going to discuss in full, because authorship is a really sensitive topic these days. And we'll see you in 15 minutes. Okay?
Chicago, we'll have to leave this Zoom link and join the new Zoom link for part 2. Thank you.
Thank you.
Thank you. Thank you, Andrew.